Okay, so thank you, Jamie Swift and Elaine Power, for joining me today to talk a bit about your chapter in Sick of the System. Remind me, what is the title, actually? What was the title of your chapter?
I think it's called A Good Idea Goes Viral,
A good idea.
which is somehow appropriate for the time of the plague.
Yeah. Okay, so tell me, why did you write the chapter? What was the drive or the impetus behind the chapter? What was the main issue that you wanted to get across?
So the main issue that we wanted to get across in this chapter is that this is the perfect moment for a basic income for Canadians. So Jamie and I have been part of a basic income group, an activist group here in Kingston for almost 7 years. And we've been working on this issue. It makes so much sense to us in so many ways that to provide an income floor for all Canadians so that nobody has to live in poverty or worrying about how they're going to put food on the table. So we imagine a basic income that would cover working age adults from 18 to 65. That would include students. I've done some work myself on food insecurity among students, so students who don't have enough money to eat. And this would be a great way to to overcome that, along with many other issues related to income.
And why the basic income now? How do you see it in relationship to the pandemic or to the health crisis in general? Yeah.
Well, in relation to the pandemic, all of a sudden, millions of Canadians have been thrown out of work. It's a moment at which many people, I think, suddenly understand the precarity, the kind of income precarity and the precariousness of the things that we take for granted that suddenly disappear. And so, although the Canadian government put the CERB, the Canadian Emergency Response Benefit, in place, and they put in a student benefit program, if a basic income had been in place, that would have been very easy to roll out.
I think also one of the things that what I call the plague, because I think it's historically resonant, reveals the manifest contradictions of capitalism. So it revealed the extent to which racialized people and women are affected much more by this kind of a scourge. Just today, the last day of July, it was appeared in the Toronto Globe and Mail that an incredibly disproportionate percentage of the people who've been sickened by this plague were people from communities of color. So I think that that is, a manifest contradiction that this has exposed. And as Elaine suggested, many of us knew that the rise of precarious work was driving inequality, and there was a huge amount of insecurity out there in the population. One of the points we tried to make in the article was that all of a sudden insecurity became democratized to the extent that it's something that can affect everybody. And so everybody from rich to poor became uncertain as to whether they'd get the plague and as to whether they'd be able to go out and buy toilet paper at first, and all these mini panics occurred. But then it slowly became obvious to people that some people always experience incredible levels of insecurity and stress as a result, more than others. So that kind of contradiction, I think it was a good opportunity to expose and discuss.
Yeah, I was struck actually by one of the examples you used of one of the people or a woman not being able to afford food. I think the question of hunger, right? The insecurity of not knowing where your next meal would come. And that makes sense, I think, to most readers. They would make sense that maybe, the right to eat should be something that is upheld and supported, or somehow underlined by the state. But I think some people would think income itself should not be necessarily undergirded by the state. It's funny because I think a lot of people totally understand in the Canadian context, we have universal healthcare, and that totally makes sense that no one should should not have access to healthcare or to a hospital or to a doctor or to nurses. And yet I think there's still that leap from universal healthcare to universal income. I think that, and I'm wondering if you could, and I know you also talk about this metric that people have in their heads, deserving and undeserving. So I'm wondering if you can just comment on those two issues.
You have to watch out because Elaine can talk at length about it.
I can. For many years, I taught a course called The Social Determinants of Health.
Yes.
And so, you know, we have this funny idea that somehow our health depends on healthcare, when in fact, you know, healthcare is really sick care. And,
yes.
you know, I really, I situate myself in public health scholarship and understanding that things like income, adequate food, having a roof over your head, having access to education, all of those things are social determinants of health. They actually influence our health. And so from a public health perspective, income is even more important than having access to healthcare. And so I think there's a way in which, you know, we have to, as in public health, we say we have to think upstream. We have to go upstream and think about preventing. Keeping us healthy is about preventing these sorts of problems that send us to the doctor and send us to the hospital. And we actually end up paying for poverty. We end up paying for not having an income floor. We pay for it in healthcare. We pay for it in education. We pay for it in the justice system. So it would actually save us money over the long term. And it would also make our healthcare, our you know, Medicare that we take so much pride in, it would make it you know, more sustainable. It would it'd create a lot more ease in our healthcare system if we had, if people had a basic income.
So in a way, I hear you saying that universal basic income is really just an extension or expansion, or maybe even an enrichment of this notion of health, right? Universal health care is, as you say, not that right now. We have universal sick care. So if we actually wanted to take care of people's healthiness or support their social and or in all areas of their health, we would have to have a new mechanism. And I guess the universal basic income is what you think could do the job. Yeah.
Yes.
That's right. I think one of the political difficulties up until the pandemic was upon us is that you can, as Elaine has just done, point out that you're going to save money in the illness care system over the long term if everybody, if the social determinants of health were say, improved and everybody had access to decent food, decent shelter, all of those things. But those arguments are hard to make in the context of a political system where a medium to long-term planning is hard to do. So as Keynes said, in the long term, we're all dead. So what you can see with the plague now is that all of a sudden it's become clear to everybody that this income support system potentially can include everybody in the same way that public health care, it's there when you need it, but you don't always need it. In the case of income support, some people need it more than others. So for instance, the so-called heroes of the pandemic period, who are suddenly heroes, people who work as personal support workers and truck drivers and cashiers in supermarkets, their difficulties are suddenly exposed to everybody else. So those are the people who had to work. Those are the people who can't work from home. So the hedge fund operators and currency speculators who work for the financial system, they can work quite safely at home. So in this way, the idea of the plague democratizing insecurity, that's where that figure of speech, that metaphor, falls down a bit. So it's not the perfect metaphor, but like many metaphors, it can be useful.
Um, thank
Sorry,
you.
Mike,
Yes.
I just wanted to say as well, you know, you talked about the right to eat,
Yeah.
but I would also point to, you know, the 1948 Universal Declaration of Human Rights that, you know, Article 25 is a statement that we Canadians, the Canadian government agreed to, that many governments in the world agreed to, that we all have the right to an adequate standard of living.
Yes.
And that includes the right to food, includes the right to housing,
Mhm.
healthcare, and so on. And so the right to an adequate standard of living is something that, you know, we've agreed to at a broad kind of philosophical level. I think
Mhm.
after 40 years of neoliberal kind of political philosophy, it probably sounds really odd to your students' ears. That idea that we would look after each other, that you're not responsible, you know, you're not responsible yourself, for you and your family, that there's a safety net, there's a collective agreement that we would look after each other. But
And
you know,
yet, I think, Elaine, we are in some respects, you know, that I think in this sense we live in a very deformed society because we also see homelessness every day, right? And we see, I mean, that would be the most egregious example of how the state has fallen down, right? Not just forget the basic income; they don't have the basic necessities of life, and so I just think, in a way, we are trained to accept that as a norm almost, and I think I can see how people would then, you know, I guess we're being trained to be less caring and
Well, I think, Mike, the norms were shattered in the early '80s, and you know, step in because Elaine would talk about this at some length. Your students, who were most of whom were born after 1980, I assume,
yes,
probably believe that food banks have always been there and they're part of the social wallpaper. That, you know, it's perfectly normal to have a significant swath of the population depend on
yes,
charity handouts
yes,
for food, what we call in this book we're working on the tin in a bin approach. You know, take the can of tuna, throw it in the bin, okay, problem solved. I've dealt with any sense of guilt that I might have about the fact that in the richest country in the world, there are lots of people who can't afford a decent diet. So that the rise of the food bank and it being part of that social wallpaper is a sign of the times. And the way I sometimes describe it, the dramatic symbol of the times is the yo-yo. Yo-yo stands for you're on your own.
Oh, I see.
So, you know, the public wheel is not necessarily going to support you except at a minimum. So you will be able to get some sickness care, but you do not have any right to affordable housing. And if you're sitting there in Vancouver, you know all about the high cost of housing.
Yes, absolutely.
Here in Kingston, it's not quite as acute. So there's another, you know, socially unmet need. And the reason for that, I think, is a classic example of market failure. The private housing market is not in the business of building affordable housing. So that's why we need some government public intervention in the form of non-market housing. So in the same way, the labor market is an example of market failure. As work has become more and more precarious, more and more people are running between 2 and 3 jobs. Personal support workers in what are euphemistically called care homes, care being a commodity that the market will sell you. You know, those folks are, you know, forced to, or were being forced. Early on, BC did well by saying you can't move from job to job in looking after our elders. But so I think all these, it's all about, to my way of thinking, the way that capitalism and the market has failed. And basic income is but one of many ways that the public, that the government, that the state can address this. So, you know, a decent non-market / affordable housing program would be another way. And people talked about pharmacare as another way. So there are all these public services that we need to build up. And many people, particularly people on the left, have said, oh, we're against basic income because we need a national child care program, or we need a national housing program. Where that thinking comes from, I have no idea. That you can't have one without the other.
Sure.
Remember Love and Marriage and the famous Broadway hit. They always go together, but not always the case.
One should not preclude the other. Yeah, that makes sense. So thank you, Jamie. So the last question really is, you wrote this basically in April. We went to press in May. So a lot has changed since you guys put pen to paper. What would you change now? Anything that you would change or update, or would you delete something or subtract something, add something? What I know you gave the example of Spain as well as one of the shining sort of beacons. Anything you would change in your paper, in your chapter?
I really like it.
I think what we did, I think you're spot on there, Mike. What we did back in April is we looked around the world as governments were scrambling to deal with the plague. And there were a couple of announcements out of Spain that the government was seriously considering bringing in some sort of basic income. Now that may have changed. I've not kept my finger on the pulse of the intricacies of the Spanish government. So there are signs that point in this direction. But I think we would probably, and will in this book that we're writing, look more closely at where things are at in different regimes, in different governments, in different countries of the world. So that's something that when you write something that has to come out right away, it's like writing a magazine article. It's a bit different than writing a book, but still in writing a book, you know, the book comes out and you can't use the word now and you can't use the word today.
No, I understand. I just meant, like, for instance, in the Canadian context, we've had the CERB now for a number of months, and then the Canadian Emergency Student Benefit is more recent, right? And then now we've had this kind of controversy, national controversy around the We Foundation. I'm just wondering if you had anything to add or to update, I guess, in terms of your thoughts on these types of, if you will, stopgap income assistant schemes that have been introduced. Yeah.
I guess one of the things that I've become more aware of since we wrote that chapter over these few months is how hard it is to change things.
Yes.
And so Jamie and I started in this Kingston Action Group for a Basic Income Guarantee in the fall of 2013. And basic income just seemed like it made so much sense to me that I thought, oh, you know, this will be easy. We'll have a basic income for all Canadians, like within a few years, no problem. And here we have this perfect moment where it's so obvious to me, at least, that this would be a much better way to provide income security for everyone. But there's so much resistance. There's, I think, a real groundswell of understanding and support among the Canadian population, but it doesn't translate into the political realm. You know, we know that the Ontario Basic Income Pilot, which ran for a short time under the previous provincial government before it was canceled, that was, you know, a particular individual who was a senior advisor to Kathleen Wynne, who was very knowledgeable about it. And the two of them just kind of slipped it into the budget. Nobody really knew. And so it was very much, I mean, they believed in it, but it wasn't because of political pressure. So how to create that momentum to actually create this policy that there's so much evidence that it would make good sense. It's really brought the pandemic and the politics around income security have really brought it home to me that evidence is necessary, but not sufficient. And that there's quite a lot of resistance, I would say, to changing the kinds of structures that are already in place for providing income security.
Okay, well, that's a perfect place to leave it. Thank you so much, Elaine, and thank you so much, Jamie, for clarifying the chapter and giving your thoughts on the work that you've done.
Okay, thanks, Mike.
Thank you so much.
Thank you very much.
Okay.
Take care.